Hi everyone, I'm Wanda. Welcome to our channel. On May 9, 2025, during an interview with Fox News, Dr. Mehmet Oz, yes, the very same Dr. Oz, now the newly appointed head of the Centers for Medicare and Medicaid Services, CMS, made a bold statement: America is a chronic disease nation. So today, we're diving into the burden of chronic illness in the U.S. and Dr. Oz's latest healthcare transformation vision to tackle this massive issue. Let's start with some data from the Organization for Economic Cooperation and Development, or OECD. Health statistics show a troubling trend. Since the 1990s, the U.S. has consistently had the lowest life expectancy among G7 countries, for both men and women. Even more puzzling, the U.S. spends more per person on healthcare than any other G7 nation. So, what's going wrong? According to Dr. Oz, the core issue is America's overwhelming burden of chronic disease. This isn't just about how widespread chronic conditions are across different populations, it's also about the death rates they cause and the immense healthcare costs they generate. As Dr. Oz put it, the basic truth is, CMS spends 70% of its budget on chronic diseases, and we're not getting our money's worth. On April 16, 2025, the Peterson Center on Healthcare and KFF released a comprehensive report analyzing how the U.S. compares to its peers when it comes to chronic disease rates. The study focused on countries with similar social and economic structures, such as Australia, Japan, Canada, and several European nations like Austria, Belgium, France, Germany, the Netherlands, Sweden, Switzerland, and the UK, to ensure a meaningful comparison. In the U.S., the most common chronic condition is obesity. America's obesity rate is more than double that of peer countries. In 2022, 42% of American adults were classified as obese, compared to just 17.8% on average in those other nations. As for high blood pressure, or hypertension, the U.S. rate has hovered around 32% for the past 30 years, while peer countries have seen gradual declines, now averaging 28.6%. Diabetes. Another red flag. In 2022, 12.5% of American adults had diabetes, the highest rate among all the countries studied. Peer countries? Just 6.1% on average, about half of the U.S. rate. Asthma is another area of concern. In 2021, the asthma rate in the U.S. hit 11%, nearly double the 6.6% average of peer countries. Since 2017, the U.S. has consistently had the highest asthma rates among comparable nations. Chronic kidney disease. In 2021, the U.S. rate was 8.2%, 24% higher than the average of 6.6% in peer countries. Only Japan has ever had a higher rate than the U.S. during the 1990 to 2021 period. Depression surged during the COVID-19 pandemic. In the U.S., depression rates rose by 6 percentage points to 22%. In peer countries, the increase was 4.7 points, reaching 16%. Chronic obstructive pulmonary disease, COPD, has held relatively steady over the past 2 decades. Still, the U.S. rate of 3.7% remains higher than the peer country average of 2.6%. And cancer. The U.S. cancer rate is 15% higher than the peer country average. Among all the countries studied, only Australia has a higher cancer rate than the United States. So why is the U.S. struggling with such a heavy chronic disease burden? It's a mix of medical and non-medical factors. Unlike other wealthy nations, the U.S. lacks universal health coverage, making it harder for many people to access preventive care. Lifestyle differences also play a role. Americans tend to be less physically active, and sedentary lifestyles increase the risk of many chronic conditions. Diet is another key factor. Plus, smoking and alcohol use significantly raise the risk of chronic illness. Chronic non-communicable diseases are the leading cause of death worldwide. In the U.S., they account for 8 of the top 10 causes of death. And many of these diseases are interconnected. Obesity raises the risk of diabetes, high blood pressure, and certain cancers. High blood pressure can lead to heart disease, stroke, and kidney failure. Depression often coexists with other chronic diseases and can worsen outcomes. Many patients must manage multiple chronic conditions at once, adding complexity and cost to their care. Dr. Oz earned his undergraduate degree from Harvard and his joint MD/MBA from the University of Pennsylvania. He's spent decades researching heart health, surgery, and health policy, and hosted the award-winning TV show The Dr. Oz Show. In 2025, President Trump nominated him as the 17th administrator of CMS, and he officially took office in April. Now he leads the largest agency under the Department of Health and Human Services, HHS, overseeing a $1.7 trillion budget and healthcare services for over 160 million Americans. During his confirmation hearings, Dr. Oz outlined a bold transformation vision for U.S. healthcare, centered around chronic illness. His first core vision: shift the system from treating disease to promoting prevention and health. The current model is reactive, focusing on treating illness after it arises, which drives up costs. A prevention-focused approach emphasizes lifestyle changes, chronic disease management, and overall wellness. Prevention reduces suffering and saves the system money. Another key vision: empower patients. This means giving Americans personalized tools and information to manage their health. It includes clear, understandable health information, tailored medical decisions based on individual needs, and better transparency in healthcare costs. Dr. Oz also wants CMS to simplify processes for providers and link their performance to actual patient outcomes, not just paperwork. This would reduce the administrative burden on healthcare workers, reward providers who deliver better results, and shift the focus from quantity to quality. Value-based care, driven by data, is a major pillar. New performance metrics will focus on improved patient health, and payment will be directly tied to measurable results. Fighting fraud and waste is also central to his vision. The goal is to identify and eliminate fraud, waste, and abuse in Medicare and Medicaid, ensuring that funds go where they're needed most. This includes ramping up audits of Medicare Advantage plans, reallocating resources efficiently, and strengthening oversight. Expected benefits: billions recovered, smarter funding, stronger program integrity, and greater public trust. By 2026, CMS plans to dramatically expand risk adjustment data validation, RADV, audits for Medicare Advantage, invest in advanced audit technology, and grow the team of medical coders and audit professionals. Oz's initiatives will roll out in phases for smooth implementation. Phase 1, 2025: enhance fraud detection, expand telehealth, and start simplifying admin processes. Phase 2, 2026: launch AI pilot programs and test new reimbursement models. Phase 3, 2027 to 2028: fully implement value-based care, nationwide chronic disease management, technology integration, and expanded prevention programs. Expected outcomes include a 20% reduction in chronic disease burden, thanks to better prevention and management. A 30% increase in healthcare access in rural and underserved areas. A 15% drop in overall healthcare costs, through efficiency and prevention. A 25% improvement in patient satisfaction with healthcare experiences. So what does all this mean for you? As a patient, you'll have more access to preventive care, better nutritional support, and expanded telehealth services. As a healthcare provider, you'll face less paperwork, enjoy more time with patients, and benefit from new payment models. And as a taxpayer, you'll see more value from healthcare spending, less waste and fraud, and a more sustainable system overall. Alright, that's it for today. If you found this helpful, don't forget to like, subscribe, and hit that little bell icon so you won't miss our next episode. Thanks for watching, see you next time.